Okay.
Okay, so it's recorded. That means now that she saw y'all's faces, you guys can turn off y'all's camera if you guys would like, but you don't have to. So anyways, let's get started because I know you guys have a life. I'm literally gonna go have dinner right after this. So
Same.
yeah, I know. I'm so hungry. But can you guys see this? No?
No.
Okay,
No,
good.
I see you.
Okay, you guys see me? Period. Okay, let me see.
Your beautiful self.
Huh?
I said your beautiful self.
Yeah. Wait. Sorry, I'm like trying to figure this out. I'm just like, I've never used this before. Okay, share screen. Okay, can you guys see now?
Yes.
Okay, is the Zoom thing in the way? Yeah.
No.
There we go. Okay.
No.
It's not full screen, but because we can
Okay,
see
let's
what you
see.
see.
I'm sorry, let's see. Full screen. Like that, and then I think that should be
Try
fine.
pushing
Slide
play.
only.
Oh yeah.
Okay,
No.
that will be fine. Okay, guys. So, well, thank you for joining. Today, I'm going to be giving my speech on why healthcare in the United States should be free. And so, I hope you guys enjoy it. Worked really hard. So, what exactly is healthcare? So, according to the Webster Dictionary, healthcare is efforts made to maintain or restore physical, mental, or emotional well-being, especially by the trained and licensed professional. In the United States, our healthcare industry is kind of like a mixed market in terms of a lot of like healthcare coverage is funded by the government, like Medicare and Medicaid, and then privately financed, so through like a private health insurance plan. And so what that means is, I don't know if you guys have this, but where you work, a lot of your employers are going to offer healthcare or health insurance, whether it's dental, medical, accident insurance. I heard that there's even insurance nowadays for people to be able to like actually pay for you to stay at like a treatment facility, whether it's like an actual hospital or like a psych ward, which is kind of crazy because that wasn't even a thing back in the day. But so that would count as private, and then we have the public, which is the Medicaid and Medicare. So is healthcare expensive in the US? A lot of people already know the answer to this. As you guys know, it's super freaking expensive. And so according to the Peterson Foundation, the United States has one of the highest costs of healthcare in the world. So on average, the average American spends about $12,100 a year on healthcare, which is up $2,100 since before the start of the pandemic, which if you really think about it, makes a lot of sense considering that our life expectancy in the US did go down as a result of COVID, and COVID-19 was also the third leading cause of death in the United States, which a lot of experts think that that would have been avoided if the US offered free universal healthcare, only because it would have been easier for people to, one, get the vaccine, which wasn't even actually possible for people to get the vaccine if it weren't for the American Rescue Plan or if it weren't for other like stimulus packages passed by Congress. So if they wouldn't have been passing those out, chances are that more people would have died in the US, and our life expectancy probably would have went down another whole year like it did during the pandemic. And so that just comes to show that healthcare is just very much needed in our country, like universal healthcare. Yes, we're one of the richest countries in the world, but just because we're one of the richest countries in the world does not mean that every single person has access to healthcare. I mean, we're spending hundreds and hundreds of billions of dollars on our military just to protect American interests when we could literally like spend a fraction of what we spend on the military, put it towards healthcare, and every single person in the country would literally be covered. Like that is really insane. But in the 90s, our healthcare was where it was really bad. Like the whole idea of us having free universal healthcare really took off in the 90s because of Bill Clinton and his administration and how he was trying to make universal healthcare, but that was pretty much butchered after his impeachment. And just because we've seen an increase in the cost of healthcare, that doesn't mean that we have seen an increase in the quality and accessibility of healthcare. going the wrong way, y'all. So, what exactly makes healthcare so expensive in the US? Why is this thing changing? Oh my God, guys. Okay, so along with high premiums, which is basically the amount of money you pay a month towards your insurance, which is basically like your car note, how much you pay a month, and a high deductible, which is basically the amount of money that you have to pay towards insurance for your insurance to actually cover you and for the benefits to actually go into place. So let's say that you paid like $5,000 over the course of a couple months towards healthcare, and your deductible is put at $10,000. So let's say that's how much you've paid, 5,000 out of the 10,000. That means that you would have to pay $5,000 more for your health insurance to actually work. So let's say, God forbid, you get into a car accident, you break an arm, you have to go to the hospital, and you need insurance to pay for it. Your insurance isn't going to pay for it if you haven't paid your full deductible. So that means that you'd probably going to have to pay for your insurance out of pocket, which, if you think about it nowadays, like in the United States, the average cost of having to go to the hospital to get your arm, like get that medical attention after you've broken an arm or like a bone or anything, is about $2,000. That's like on the cheap end, guys. Like if you go to other major cities, it'll be like more expensive. Like in New York, it'll probably be more expensive there than it would be in Houston, only because accessibility to hospitals is higher in the and not in the United States, but in Houston. So that would be very detrimental because a lot of people actually have to file for bankruptcy if they have to go to the hospital. Like if you stay in the hospital for 2 to 3 days, chances are you're probably going to have to file for bankruptcy if you're not actually able to pay for it, just because a lot of these hospitals are predatory. So since healthcare is not actually regulated in the United States, health insurance companies and hospitals can ultimately pay whatever they want to, like can charge you whatever they want to charge you. At times, people literally go into the hospital, get treated for something, and they'll receive 3 different bills once they actually go home and leave the hospital, only because hospitals don't actually employ a lot of the nurses and a lot of the doctors that work in the hospitals. The way that it works in the US is that hospitals are owned by a company, and then doctors and nurses are employed by a different company that send their nurses there as well. And so whatever they choose to charge a patient, they're going to have to pay half of that money that they make off of that patient towards the hospital, because the hospital is what's actually hosting, the doctor and the nurse. So let's say that if you guys ever go to the hospital to get some blood work done, which by the way is very expensive nowadays, it costs like $500 just to do that. But let's say you go get your blood drawn and you get some blood work done. Once you go home, you're literally gonna probably get like 3 different bills, because you're gonna possibly see a doctor once your results come in and they have to talk to you about your results. A phlebotomist you'll probably get a different bill for the phlebotomist, because chances are the phlebotomist and the doctor are not employed by the same company. And then let's say that a nurse comes and takes your vitals. That nurse is probably owned by a separate company as well. So you'll probably get 3 different like bills, which is really insane to think about. It should all be in one, which a lot of people in Congress have talked about, that if we're not going to at least offer universal healthcare, then why don't we put caps on the amount of money that a hospital can charge for things like breaking your arm, breaking your leg, or things like that, things of that nature, basically. So why should healthcare even be free in the US? So according to a Harvard study published in 2020, free healthcare in the US would save more lives a year. The lack of health insurance is associated with as many as 44,789 deaths per year. And the United States is actually ranked at the bottom of a list of 16 rich nations in terms of preventable mortality. So that means that basically in simple terms would mean that if we were to offer free universal healthcare, more people would accept healthcare and they would, have their life saved. Because nowadays, a lot of people refuse to even go on like an ambulance, because ambulances can charge you up to like $4,000 or $5,000. So that's pretty crazy to think about. I mean, even when I was being born, and this is, coming from my mom refused to take an ambulance to the hospital back in 2001 because she couldn't afford like the ambulance. I mean, at that time, the ambulance was charging like almost $1,000. And even then that was considered insane. you know, in the late 90s, early 2000s, like that was considered a lot of money. Nowadays, like they charge you, the price of an ambulance tripled and quadrupled. So my mom literally had to like be taken to the hospital in the car by my dad. So that's crazy to think about. That a woman that's literally in the worst pain that she might ever experience isn't able to go on an ambulance because she can't afford it is honestly should be a clear sign that our country is not doing enough. So the founding documents of the United States actually provide support to the healthcare, to free healthcare, which is basically the idea of an unalienable right in the pursuit of happiness. So a lot of people in Congress and a lot of people in general in the country view access to healthcare, access to being able to get treatment when you need it and when you want to receive it as an unalienable right, like other people in other countries do, like in the UK. If you go to the hospital, it's free because it's funded by tax dollars. And the pursuit of happiness, I think that if we're healthy, then that would equate to us pursuing happiness because I mean, we're happy when we're healthy, right? We're not going to be healthy if we're struggling with a huge bill and having to literally work 2 to 3 jobs to pay back that money, that cost that you have to pay. So free universal healthcare would also decrease the number of bankruptcies that are filed every year in the United States because a lot of people actually have to take out loans to pay for this, which is just incredibly, you know, ridiculous. US healthcare expenditures, that's it's separated into 3. So out-of-pocket costs, private insurance, and Medicare. Private insurance is basically the most common insurance in our country because most people get their insurance through their employer, which is where they add their spouse and their children. Out-of-pocket is anyone that doesn't have insurance, they actually have to pay that out-of-pocket. And then Medicare is basically like the government-funded health insurance that is provided by the government for people that are low income or people that are elderly. What would be the effects of universal healthcare? So healthcare would be more accessible. A lot of people in Congress, specifically people part of that are part of the Republican Party, actually think that healthcare, if it were like free and universal, that it would increase the wait times in our hospitals. Which, if you look at statistics right now, our wait times in hospitals are actually a lot longer now than they would be if we had free universal healthcare, just because a lot of skeptics and people that are against free universal healthcare think that if more people had the opportunity to actually go to the hospital for anything, then we would have more people in the hospitals. We don't really know the answer to that, but we would have to wait and see. Our country would be healthier. We could tackle crises like the obesity crisis in our country because that crisis is just getting worse and worse by the minute. Our life expectancy will most likely go up, like I had mentioned earlier. Our country would also be in a better, have a better chance of fighting outbreaks and pandemics, like we have seen in COVID. If we had for universal healthcare, then we definitely would be able to tackle the pandemic if we would have had it, because vaccines would have been delivered at a much faster rate, and also because the research done to actually, you know, investigate such diseases would have been much easier. And plus, a lot of the money that would be spent on healthcare, we could also spend on providing research dollars for the CDC. But that's another conversation for another day. Our government would also have a better shot at delivering vaccinations, like I had just mentioned earlier. But yeah. I think that's actually the end of my presentation. Yeah. Any questions, comments, concerns?
You
Well,
did so good.
thank you.
I
Okay.
liked it.
Okay, thank you. Do you have any questions? I know that it probably would have been better and a little bit longer, but that, I don't know. I didn't take too long to do it. Ooh, but yeah.
It was good.
Okay, bet.
I liked it.
Good length.
Okay. Thank you guys. Well, thank you so much for meeting me, guys. Let me just end it right now.